Hi, I'm Madison Abernaz, and I will be talking about the ever-changing health insurance policies that we have been seeing in this most recent election season. The change that I'm specifically going to address is Medicare's coverage of prevention for diabetes. Now, if you don't already know, Medicare is a system that allows the government to take care of individuals over the age of 65 who do not have health insurance. This is in contrast to its counterpart, Medicaid, that aids in people who are in lower socioeconomic statuses that cannot afford healthcare for themselves. This policy change that includes prevention for diabetes is incredibly important because in the past, prevention programs have not been nearly as important for Americans in general. As a public health major, I can say that prevention is what makes a population healthy. If you avoid getting the disease in the first place, there's a high possibility that your population will stay healthy for longer. In this specific case, Medicare pays about $42 billion more on those who have diabetes than on those who do not. This is to say that though the upfront cost may seem like more, in the end, preventing a disease from ever happening will save the government and the taxpayers billions of dollars a year. In this situation, we have two groups that are directly affected. First, we have those who do not have diabetes and are under Medicare. Now, they have the ability to seek prevention care so that they do not have to live with this debilitating disease. This could save them billions of dollars themselves and years of their lives. The other major party that's directly affected by this policy change are those who are under Medicare and do have diabetes. This change could mean a reallocation of funds to try to find better treatment for diabetes or treatment for other illnesses that these people may be suffering from as a result of their poor health. Indirectly, this policy change affects the entire American population. We can see a reallocation of tax money going into things like infrastructure and education, even environmental protection. Saving money here in Medicare could mean a better population and a better country overall. The line of reasoning that those fighting for this policy change followed was this: paying seemingly more money up front would in the end save billions of dollars later on in avoiding treatment costs. This is a very popular argument for most public health officials that are fighting for prevention coverage in healthcare. I'm happy to see that this is finally taking hold somewhere legitimately. Since I came to Shenandoah and started studying public health, I have found that prevention would be the easiest way to treat even our worst diseases. Though, because prevention is not necessarily something that you can see, feel, or touch, many have ignored it and said that it's not worth the money that they would be spending upfront. I was so excited to find this article because it's the first signs that I've seen of actual prevention work being taken seriously. And the only suggestion that I can make is an expansion on this already amazing plan. While diabetes is important and it's incredible that we're preventing it in an older age, I think that we need to start a little bit younger and prevent other chronic diseases. Now, I know that might seem far-fetched, but if we work harder for prevention now, we will definitely save money in the future and will also have a healthier population, a population that's living without the necessity of relying on drugs and hospital time so that they can continue their life, but a healthy generation who's able to work longer and keep the country running smoothly. Like I mentioned earlier, this change happened right before a major election. My only concern is that this plan or other prevention plans in the future could potentially be taken away under new administration. This terrifies me as a public health major because community health and population health are my concentrations here at the university. And in order to see communities and populations healthy, we need to start with prevention programs. I think that this specific program is a step in the right direction and that it needs to be taken seriously and expanded upon in the future years as chronic disease becomes more of a problem in our country. Thank you so much for watching this video. I really appreciate it, and I can't wait to read your comments about this topic that I've brought up.